So good afternoon, everyone, and welcome. My name is Carrie Craven. I'm Administrative Specialist for KCMPA, and we're so glad you were able to join us today. First off, we ask that while the webinar is in progress, that you mute your phone lines to ensure that everyone can clearly hear the presentation. Please press *6 on your landline phones to mute, or the mute button on your cell phones. If you have a question, you may ask it via the chat window in the GoToMeeting dashboard, and we will get to it at the end, or you can ask it live when we open up the lines at the end for Q&A. Joining me today is Cindy Campbell, Director of Clinical Strategies for KCMPA. Cindy is going to talk about annual wellness visits. Cindy, go ahead.
Great. Thank you, Carrie. So I want to thank everybody for joining today. It feels good to kind of get our webinar series, our monthly webinar series, back on track and flowing. We missed a couple of months just because of some vacations and accessibility, and then some of the topics that we had planned. We didn't have all the information available yet. So now we are back on track. So I want to thank everyone for joining me. So I want to also just, you know what, make sure my slides are, guess I'm going to have to use my, another way to move my slides. My arrow buttons aren't going to want to work. So anyway, here is a look at our upcoming webinars up until December. And if you notice, we do have a special session planned for October, and we want to bring someone in from Medicare to talk a little bit about understanding MIPS and MACRA. I know a lot of us, have a good understanding, of what it is, but really those detailed pieces of it, what it means at the clinic level, what do we have to do, I think is something that we would love to be able to get a, somebody from Medicare here. And I know Carrie has put in that request, so we will keep you updated on what is happening with that. And as well, we pretty much try to stick to these topics. Sometimes the subjects can change, and that's really based on, if something comes up in our industry that we really think you all need to know about, or different topics, and we're getting requests for information around certain topics. We are preparing, October will be the release of the 2017 physician fee schedule. So just keeping that in mind, we also may be able to set up some additional training around that, because we always anticipate that there will be some changes. I know that in particular there's going to be some changes around the CCM program, so we'll keep you updated with that. Okay, so moving on. And one last thing I did want to say is that if you'll notice some of these topics here, we've done a lot of in-depth, different webinars on different topics, but we thought we'd kind of take a few and just kind of get back to our basics again. Hence, that's why we're talking about the annual wellness visit. And I realize that a lot of you are doing the annual wellness visit, but maybe we're not doing it to the extent that we can be. But if you'll also notice that we have the huddle, the planned visit, addressing some care gaps. So we just want to maybe just take it back and just some of those, back to some of those basics and go back and revisit those and make sure that we are maximizing those. I think it's always a good idea to do. So moving ahead here, the Medicare annual wellness visit. So what we're going to be talking about today is, of course, what is it? What is the annual wellness visit? We'll talk a little bit about what the differences are between the G codes. And I know you know a lot of this, but once again, I think it's always good just to kind of get a refresher. Requirements, we'll talk about how we can plan for those visits so that they aren't so cumbersome. And then we're going to talk a little bit about population health in general, and I always feel like we can't talk about, just the health of one population, which we know the Medicare annual wellness visit is for our 65 plus aging population. But I always feel like that it's a part of population health, and that when we look at what we're doing for our entire population and how are we applying health and wellness needs and requirements for our entire population. And then we're just going to talk a little bit about some team-based care and workflows around not only the annual wellness visit, but around health and wellness needs of our entire population that you're serving in the clinic. Okay, so let's get started. So the annual wellness visit, what is it? So starting in 2011, the Affordable Care Act allowed for a preventative physical exam. The purpose of this service is to develop or update a personalized prevention plan that will help to prevent disease and disability based on the patient's current health and risk factors. And as you all are aware, these are G codes, so there's no cost to the patient. And there is a clear difference. We have three different codes, and there's a clear difference between the three of them. So we have the G0402, which is the Welcome to Medicare annual AWV, G0438, which is the first annual wellness visit. And right now, that one is paying out at about $172 for a visit. I think that the G0402 is approximately the same. I couldn't find the exact number, but I'm assuming that it's probably somewhere around the same. And then the G0439, which is the subsequent or the yearly annual wellness visit, which is paying out approximately at $111 per visit. So I just want to say, that this is a way that we can capture the health and wellness needs of our aging population, and that we can begin managing them by identifying their risk and their health risk factors, at an early state. And also to keep in mind that these visits, whether it be a Welcome to Medicare first, annual wellness visit or a subsequent, these are a really good time to evaluate your patients and their eligibility for the chronic care management program, and to get their consent forms signed. I'm not sure what that consent form process is going to look like with the 2017 physician fee schedule. Sorry, I'm kind of talking, a little bit out of the annual wellness visit, but I just saw something yesterday that it is being considered that the consent form will go away. So just keep in mind, it does have to still continue for the rest of this year, but moving forward in 2017, fingers crossed, we may be able to eliminate, that extra piece of the consent form. So with that, move to the next slide here, and here I really want to kind of get into some details of the what the requirements are for each of the G codes. And I know that you know a lot of these. I won't go into a lot of discussion because they're pretty much the same between the three, and I know that you know a lot of these, but I thought it would be good to just kind of review and just refresh pretty quickly. So requirements for the G0402, Welcome to Medicare. Of course, this is an introductory visit only. It happens within the first 12 months of the beneficiary coming into or aging into Medicare. It's a one-time visit that's covered, the review of medical and social history, and doing things such as their height, weight, blood pressure, BMI, a vision test, depression screening, assessing what their level of safety is, and offering to talk to them about an advanced directive. And then, of course, the written plan around their screenings, what their screening should look like in the next few years, any type of immunizations and other preventive services. So kind of putting that plan together for the patient. And then the requirements for the first annual wellness visit, which is the G0438. And this is, they establish, once again, this is a one-time only. They don't, this will only be paid out one time. And this is to establish the medical and family history, establish a list of current providers and suppliers, those folks that, medical care folks that are involved with the patient's care or providing any type of care to the patient. Of course, the height, weight, BMI, blood pressure, all the routine measurements, or any of those things that might come, be kind of discovered in the course of the patient's medical or family history that they would want to follow up on. Assessing their cognitive impairment, a depression screening, and then the patient's functional ability and level of safety based on, what is being observed at the practice level with what is the provider observing, or using some type of a screening tool. And then once again, a written plan around what their health screening, immunizations, preventive measures should be. And if they have done a Welcome to Medicare, then a lot of this is going to be already done. Same for establishing a list of risk factors and health advice on those identified risk factors. So this could be things such as, if they have a high blood pressure or high cholesterol, or if they are tobacco users. So these are those types of risk factors that they could be identifying at that point. Does anybody have any questions so far? Any comments? Okay, we will move to the next one. So the next and the final for the G codes is the subsequent annual wellness visit, or the yearly, which is G0439. So this is for those Part B that are not any longer in their first 12 months, but have passed that, and so they can have an annual wellness visit. Every 12 months. It's covered. It is a rolling window, so an 11 full months must have passed since the last visit. So they do not have to have a Welcome to Medicare or a first annual wellness visit to have a subsequent annual wellness visit. So just keep that in mind. That's not a requirement. They do need to have a health risk assessment done when they come in. A lot of you are probably already using some type of a tool. If you are not, I do have a link in here where you can access a multitude of tools that have all of the requirements that Medicare wants included in the health risk assessment. So feel free to pull up that link at a later time and screen and look at some of those HRAs. Once again, a review of family and medical history, updating their list of current providers, prescriptions, who are they seeing as far as specialists, anyone else that's involved in their care. Height, weight, blood pressure, other routine measurements updated, and pretty much the same thing as the previous. You want to detect any cognitive impairment, provide personalized health advice around their risk factors or around any type of conditions that they have, providing a list of risk factors and treatment options, and then their screening schedule. So every one of these G codes are pretty much the same. So as they come in, and you start getting these established, it's pretty much just getting them updated from their last annual wellness visit. And so I just want to talk just a minute here around advanced care planning. So Advanced care planning did used to be an optional element in the G0439. So it is still part of the Welcome to Medicare. However, the yearly annual wellness visit, it's an optional element. If advanced care planning services are provided, then that can be billed out, that is reimbursable, using the CPT code of 99497, which is an $80 reimbursement fee, and then an add-on code if they have an additional 30 minutes, which is the 99498 at $75. So that's good. That's good to keep in mind, that if they are going to be doing advanced care planning, which I always, I'm a huge, and I think most people are a big supporter for this age group of looking at advanced care planning and being able to, have that discussion with these patients, and that it is a separable or a separate code that can be reimbursed. Okay, so let's talk about how at the clinic level, you're planning for the annual wellness visits. And I really like to kind of just go into this with more of questions, because I think it's more questions around how is it being considered in your clinic, and what are you all doing, rather than me saying this is exactly how you should do it. Everyone's clinic functions a little bit differently. You all have yes, you all provide patient care, but everyone has a little bit of a different culture. They have a little bit different workflows, and so I think these are always a good way to approach it as how can you integrate the annual wellness visit into your clinic. So things such as pre-visit planning. How can you do some pre-visit planning on the phone prior to the visit? How can you call those patients, get some of those questions answered, get some of that the information preloaded into the patient's record and ready, so that then upon their visit, that those pieces are already done, and it can make it go much faster and be streamlined. Planned visits, so looking at who is already on the schedule, who is coming in, who should be having an annual wellness visit, who's eligible for one, and how can we get that done, since if they're already on the schedule and they might be coming in for something else, going ahead and doing the annual wellness visit. And then, of course, I'm a huge supporter of routinely looking ahead, running reports, looking at your patients. With the new Health Endeavors vendor system, you can go in, you can pull up your patients, and you can see from one of their reports there who is who is ready for another annual wellness visit, and who is, and then you can be able to pull those patients up and get them scheduled to come in. So looking ahead and being proactive. And just as another note on that, for those patients that are in the KCMPA chronic care management program, that is something that we routinely look at with that program. We look to see if the patient has had an annual wellness visit, or are they due to having one come up. And we try to get that communicated back to the practice that this patient is due for an annual wellness visit. And so if you could please get them on the schedule and get them scheduled for one. Are there any questions at this point? Does anybody have any comments, anything different, or any that they do around getting patients scheduled for annual wellness visits in their clinic? Okay, we're going to go to the next slide. and this slide is just a screenshot that shows where we are for the annual wellness visits for KCMPA for our entire Medicare beneficiaries. So we are about 40%, let's say, I think we're close to 12,000, I believe, in our beneficiaries, and we have about 40% of them completed. And remember, this is a 12 or 11-month rolling window, which still leaves a significant amount, about half, that we are still waiting or incomplete and can still be coming in and getting those annual wellness visits completed. I do believe that this has increased, and this is much better than we have done in the previous years, which I think is says a lot for our clinics and where they are focusing in on health and wellness around their Medicare beneficiaries. So I just wanted to put this screenshot in here and give you all just a little bit of an idea of where we are with this as a whole throughout our organization. Okay, and I think it's important to also talk about the health of the population. So, the population health, it basically means that we're applying health and wellness needs to the entire spectrum of our clinic population. And really, all adults should be coming in to visit their healthcare provider from time to time, even if they're healthy, to screen for diseases, look at any health risks, encouraging healthy lifestyles, vaccinations, and then once again keeping that relationship up with their healthcare provider and their healthcare team. Understanding what the recommended guidelines are for gender and age. So looking at, the male and female population between 18 to 39 or 40 to 64, and, what are the recommended guidelines for when they should be able to come in or when they should be coming in for normal wellness screenings. And I do have a link in here, once again, that provides those guidelines and, what should be screened for those age groups. This is one of those things where I think, yes, the annual wellness visit is for our Medicare population. However, don't forget the rest of the population that commercial payers do cover, for the most part, wellness screenings. They will cover that, annual or biannual physical exam, coming in, getting their labs drawn, especially the population of 40 to 64, doing cholesterol screenings, other type of screenings, that those will be covered. Those are typically covered. Any questions around that? Okay, we'll move to the next screen here. And once again, this is just around team-based care and workflow. And once again, these are really questions, and these are questions for you all. And how do you employ team-based care and workflow to achieve population health? So how are your population health needs managed amongst the team? Who's running these reports? So who looks at it? Who knows which patients need to be coming in for annual wellness visits, or that they haven't been in to see their provider for an annual exam? Who's doing pre-visit planning? So now we've identified that we have this group of annual wellness or patients that need annual wellness visits. Who is actually doing the pre-visit planning piece? Who's doing that and getting that prepared so that when they do come in, it shortens and the amount of time that they are in the clinic, and the provider can also be prepared because they have the information. And when we talk about the planned visit, so who is pulling up the reports? Who is pulling up the schedule and looking at who's coming in for the next week or the next 2 weeks that might need certain types of labs, or who needs an annual wellness visit. And, you know, we can then capture them at the time that they're coming in. Or we can even ensure that we're getting, you know, if it's somebody that maybe they haven't had, you know, a lab value that needs to be followed up on, and they haven't had it for 6 months, that's a good time to call them, have that lab drawn prior to them coming in. So that's just an example, but you know, looking at what your workflows are so that these can be completed. And once again, it's all about being proactive and not working behind. That how do we have more of a proactive approach to our model of care delivery within the clinic? And then how does the team themselves interact with ensuring that health and wellness needs are met? How are we educating our team, the healthcare team itself, about annual wellness visits, about population health needs, about the health needs of, you know, any of our chronic patients with chronic health needs, or just, you know, based on age and gender? What is the team, what's their knowledge base, and how do they interact with each other to ensure that these are all met? So my very last slide, and I just put this in here because I thought this would be a really good time for someone to maybe share with us, someone on the phone, what they are doing around annual wellness visits, and not only ensuring that the yearly ones get done, but that they're aware of who is aging in and who is getting them in for their Welcome to Medicare or first annual wellness visit, or even, you know, their routine yearly annual wellness visit. So does anybody have anything that they want to share around what their clinic is doing and what that process is looking like that they might want to share with others? Or maybe somebody is having a specific challenge to getting these done and might want to know what other people are doing, what other clinics are doing.
Hi, Cindy, it's Mary. I have to say that still being relatively new to all this, and I do see there's not a whole lot of callers on the line, so I will go ahead and share, even though I'm not saying mine is best practice, but just it's kind of evolved into, I really do daily pre-visit planning. I mean, with the volume of patients that we see every day, it's really not feasible for me to look weeks ahead. And I think you know my struggles with some reporting capabilities that I lack in NextGen, but I do every afternoon look at all 4 providers for the very next day to see who's due for the Prevnar, for their AWVs, for their MAMs, for really everything that you're talking about for preventive, as well as getting their AWVs and physicals done. And they pretty much, I know for one of our providers, Dr. Harwood, he kind of lives and breathes by that. And if there's 4 AWVs scheduled for his 22 patients, he usually will get them all done. And it's just having them being reminded. Now, that said, there are some days that, you know, the Patel team will have 6 individual patients that need their AWVs just because of the way that it's falling. And it's not practical to get all those done, but we will make a note and ensure that that gets done at the very next visit. So, you know, it's not just AWVs, but it's kind of that whole, as you were talking population health, you know, what do they need? And certainly with, you know, HEDIS measures getting met as well. So that's what we're doing at UMG.
That's great information, Mary. And just, you know, I know that for the other callers on the line, none of this was being done a year ago when Mary started working in that clinic. So Mary has really worked hard to establish a process to get these completed. So that's great to hear that you've made such progress and you're adapting to how your clinic works. And it sounds like you are always trying to figure out how can we do this and, you know, even better. And I think That's great.
And I'm open to suggestions. If anybody knows of something that will work better, I'm always open. So, and thank you for that, Cindy.
Great. Well, thank you so much, Mary, for that. And I think, this is something we could even add into one of our care team consortiums and talk, more in depth at that point about how, what the workflows are around annual wellness visits, population health, those type of things. So does anyone else have any other comments or questions before we end the call?
I don't.
Well, okay, great. I'm going to take that as a no. So at this point, I want to thank everyone for joining our webinar today, and I look forward to seeing you all soon, and I look forward to our next webinar. So thank you, everyone.
Thank you. Thanks. Sorry I was late.